Cognitive theory is defined as an approach that looks at an individual's thought process and tries to interpret the reason behind the different human behaviours. In terms of this being applied to newborn behaviours, you can look at John Locke, who describes that babies are born with a blank slate, tabula rasa, and then Piaget. Piaget, 1936, believed an individual enters different stages as they grow up, and this knowledge can be applied to newborns. A baby is born with a number of reflexes: root, suck, Moro, tonic neck, grasp, Babinski, and Stett reflex, and these define the first month of a baby's life, helping to establish the normal brain and nerve activities. After, the following stages then occur up until a baby is 12 months. To test perceptual and motor responses, we can use the Bailey Scales of Infant Development, developed by Dr. Nancy Bailey in 1969. It includes both mental scales, responding to sound and falling objects, and motor scales, assessing the gross and fine motor skills.
From a cognitive perspective, it is important to take into account when a baby's depth perception begins to develop. The question of nature versus nurture arises, in which nativists claim that depth perception was innate but develops more as the baby gets older. Arguably, the survival of humans can rely on depth perception at birth because babies will need to avoid tops of stairs or high objects, for example. On the other hand, empiricists claim that depth perception will be learned through experience. Research supporting the nativist view came from a study by Gibson and Walk in 1960. They placed both infants and animals on a visual cliff. The visual cliff was a large glass sheet 30 centimetres from the floor. One side was a pattern material placed under glass, whereas the other side was placed on the floor, giving the illusion of a deep side. From there, a mother would call a baby from both sides and see which way they would go. Out of 36 infants aged 3 to 12 months, 27 out of 36 moved to the shallow side and 9 simply did not move. Therefore, this would support the nativist view that depth perception is innate within newborns.
The Perception of Facial Expressions in Newborns by Teresa Ferroni, Enrica Menon, Sylvia Regato, and Mark H. Johnson. They studied full-term newborns taken from the maternity ward of a hospital by placing them in front of a screen. The researcher then presented a face to the newborn. When their gaze left the face, the image was changed to the next face, and the time they spent looking was recorded. They found that when comparing a happy face to a fearful face, newborns looked longer at the happy one. This preference suggests the ability in newborns to discriminate between facial expressions, i.e., happy faces from fearful faces. However, the study found no discrimination between fearful faces and neutral ones. This suggests that some facial expressions are preferred by newborns.
Hi, my name's Eve and I'll be looking at imitation as a newborn social behaviour. It's argued that imitation is used by infants to receive care and attention and is therefore an adaptive behaviour that social learning theories would say is maintained through reinforcement, which in this case is the care and attention. A study by Andrew Meltzoff and M. Keith Moore showed that the number of infant tongue protrusions was significantly higher when the infants were shown tongue protrusions as opposed to when they were shown head movements, and vice versa. One theory behind this is Banjora's social cognitive theory, which suggests that imitation as a behaviour is obtained through 4 things. The 4 things being attention, retention, reproduction and motivation, and as said before is maintained through reinforcement.
Nowadays, the main view of attachment is derived from the theory first proposed by John Bowlby in 1958. Bowlby's theory is an evolutionary theory because, in his view, attachment is a behavioural system that has evolved because of its survival value and ultimately its reproductive value. According to Bowlby, children have an innate drive to become attached to a caregiver because attachment has long-term benefits of imprinting. Since attachment is innate, there is likely to be a limited window for its development, i.e. a critical sensitive period. Development of all biological systems takes place most rapidly and easily during a critical period, but can still take place at other times, sensitive periods. For example, when a baby is growing in the womb, there is a special time when the arms develop. Some forms of maternal illness during this period may prevent this happening at that critical time, and the window for arm development passes forever. Bowlby applied the concept of a sensitive period to attachment. He suggested that the second quarter of the first year is when infants are most sensitive to the development of attachments. As the months pass, it becomes increasingly difficult to form infant caregiver attachments.